Hello and welcome to Thoughts on Therapy. I'm Bryan Stevens, a licensed professional counselor with a practice in Marietta, Georgia, and the founder of TalkForward, who's bringing us this podcast today. I've been active in behavioral health for over 25 years, and in this time, I've met all sorts of knowledgeable people. Thoughts on Therapy is the show to bring their knowledge to the general public. Today, I'm excited to be talking to Damaris Scott. She's a licensed clinical social worker who started working in mental health, substance abuse, and elderly communities in 2001. In 2004, she transitioned into the Child Protective Services for the state of Connecticut's Department of Children and Families, working there for approximately 15 years. As a case manager, Damaris provided support to families in many walks of life. In her work and investigations, treatment, permanency, which is the termination of parental rights and adoption, she quickly learned the many ways the trauma of substance abuse, poverty, mental health problems, physical, sexual, and moral abuse, as well as neglect, had strong negative impacts on families. This is the experience that drove Damaris to have a passion and drive to help parents heal from trauma. Once she was licensed, she started to work with children and families in the community by providing in-home family support by means of therapy, crisis intervention, and various settings. Currently, she's working with adults and helping them heal from their trauma, and she is pursuing her postmaster's certification in trauma studies. Her focus is using trauma-informed care and working with adults with evidence-based practices of cognitive behavioral therapy, EMDR, polyvagal therapy, and mindfulness. While she's currently settled in Georgia, Damaris is still licensed in Connecticut and in Tennessee, where she pursues her love of helping others heal. Well, good morning, and thank you so much for being with us today.
Thank you. Thank you for having me.
So, and also kind of let me say thank you for your 15 years of service and Department of Family Services. That is a long time to go. As a veteran of community mental health, myself in Georgia in the CSB, I have a great appreciation of kind of the work of being in a government agency that's overwhelmed and underfunded.
Yes.
So that's always vital that we have good quality people that are still willing to be on the ground to help those populations. So with that in mind, I'd be kind of interested to hear a little bit about your transition from child protection to providing therapy.
So I got to a point where I felt that the services that I was providing was not really hitting the core issues that families were facing. Okay. So it was almost like they were being, their past was being utilized, in order to determine who they are presently. And they did not have the adequate services in place to get them to a healing point so that they can be effective parents.
Okay.
And also battle with other issues such as poverty, mental illness, substance abuse. So it was more so like the mandates placed on them at times were unrealistic or not planned accordingly so that they can have more motivation to change with, yes, your children are a motivation. However, sometimes people don't know how to, so I wanted to address those issues and motivate parents to go above and beyond. And, understanding that my passion was greater than what I was allowed to do. So I was very limited.
So it gave you a good grounding. It's an interesting way to think about it. I think that the services, we might call them family services, but they're so focused on the children. It's kind of the identified client. This is the person we're taking care of. Let's make sure we take care of the child's trauma. Maybe without supporting family members or parents, many of whom, I think my experience was it had trauma themselves in their lives. And now there's more trauma that they experience. And I think kind of to your point, maybe they don't know how. Most parents I've worked with are doing the best they can, even if unfortunately that kind of falls disastrously short of what is needed. And many of them are desperate for any tools they can get. So that kind of sounds like what my experience I saw in the community services board. So
yes, and there's this notion of generational trauma as well.
Mhm.
So as parents, parents learn from their parents. And we come from generations of, people not really understanding what trauma is. This is our norm. This is our bubble. This is how we cope with certain things. And in my studies, one thing that I have gotten to learn is that PTSD, was not around until 1980.
Right.
I'm, learning more so from Dr. Bessel van der Kolk, who actually has taken this trauma under his wing and gaining more knowledge and performing studies and research on it. And, it's very fascinating to see all the work that has been done to allow trauma-informed care and other modalities of treatment to evolve.
Right.
However, this is still like almost like toddler stage, because it's like, yes, they know about it. However, the awareness of it is really not out there like, it should be.
Right. I agree. And I think a lot of people suffer more than they absolutely would have to in life because it hadn't been addressed. I also know kind of from my own experience, with working with people in trauma that it takes some preparation in getting ready. So you made this transition, and what did you do to get yourself ready? I mean, obviously you go to school, you get a degree, you get licensed, but what did you do to prepare yourself for this work?
To be honest, some of it is innate, some of it is like passion driven,
Mm-hmm.
because I do as well have my own trauma history. And in my, dealings with my own treatment is learning to have compassion and grace. And it's given me a hunger to learn more about, okay, why do we function this way? Why, especially now during the pandemic, we have an increase in depression, anxiety, a lot of like trauma symptoms. And,
Right.
It's almost like I want to help, but can I get to a point where, my skill set can increase to a point where I can accommodate a wider variety of clients. So that's pretty much where my hunger came from, as well as with my experience. But, in preparation, I've, looked at different trainings into like EMDR, polyvagal theory. I, like I mentioned earlier, I've been following Dr. Bessel van der Kolk in part of his master's trauma studies program through PESI. And also I learned of this holistic psychologist. Her name is Dr. Nicole LePera.
Okay.
And she's actually from the West Coast. And she published a book called How to Do the Work. And I was very intrigued by it. And I literally read it in like not even 2 days. I was so,
Right.
I heard it through Audible, and then I had to buy it. And it put a lot of things into perspective because, sometimes we, especially now during the pandemic, we're almost like monotonous, very robotic. Like we got up every day, we do the same thing. There's, our activities are somewhat limited. So life can be dreary sometimes. So it's a matter of like, what do we do? How do we change? How do we learn how to cope within these new parameters? And with reading her book, I was able to gain a lot of knowledge on the polyvagal theory, how like our mind, body, and soul is impacted, and how we can start our inner healing procedures and things of such. I've been incorporating that with working with my clients because a lot of people are going through the same thing.
Absolutely. And I kind of think with the pandemic, one of the things that seems to have come up for people with trauma is they have decreased the amount, some of the demands have decreased, or the things that are keeping them busy. And, now what's this emotions? What are these things coming up? I've often talked with clients of trauma. I've said, it's like, why am I experiencing this now? And I've always subscribed to the theory that you're ready for it, that we experience trauma, we have a natural reaction to suppress it. once we have the resources to manage it, it will come back up. And so it's like, I was functioning fine. I thought this was behind me. Why is this coming up now? Well, because you have the resources to manage it now. So let's dive in. And I do think, I kind of agree with you. I feel like we're in our infancy. We talk about trauma and focused therapy. I think that ought to be how we're trained in school from day one. By the way,
Yes.
everybody has trauma. How do we deal with it?
Yes.
I've talked a lot about grief, and I think that as a society, we don't understand grief. We don't treat grief well. You're allowed to feel grief when somebody dies, but we expect you after 6 months to be better. And
Right.
grief is traumatic. Grief of a dream. I didn't get into the school I wanted to. My marriage broke up. My kids didn't succeed the way I wanted. Whatever it is. These are all grief events. We don't honor them. We bury them. And now we've turned what we might have processed as a grief event into this traumatic stuckness.
Yes. Yes.
that we're caught. So I guess that, to me is why it's important. So you're really passionate about trauma. I think you kind of said already, you had some of your own experience.
Yes.
And that's led you into really wanting to focus down on trauma. And
yes.
So I guess my question would be, how have those experiences, that you've had, both kind of, I guess, personal and professional, helped you, help your clients?
It makes me more empathetic to what they're going through.
Mm-hmm.
And it also, excuse me, it also makes me have more grace and understanding of their present situation. And, it also gives them hope.
Right.
Because yes, we go through these adverse situations that sometimes are out of our control, especially like when we look back at, infancy, where if we don't have that positive, nurturing attachment with a provider, parent, or whoever, it starts from day one.
Right.
So it's like at times, with looking at my clients now as adults, and they're experiencing issues with relationships, with establishing boundaries, that inability to really process their emotions. So it's, I give them a safe space where they can learn to evolve and learn more about themselves.
Right.
Learn more about, okay, well, this is happening to me now. Why is it? Yes, like you mentioned earlier, the pandemic is forcing people to really sit with themselves and sit in situations like their children are home with them, their spouses are home with them. So it's like, oh my gosh, yes, I was working all these crazy hours. Now I'm home and I have to kind of like sit with this. What do I do?
Right.
Why do I feel more anxious? Why do I feel more depressed? Why, I have lack of motivation. So I bring my client back to understand more so, where are you coming from and what happened to you? Right. I think that question is very important, more so, so that we can better address the symptoms associated with what's going on now, but that question of what happened to you.
Right. I think, it's very important, because I work with clients to say, congratulations, you've survived to today. You developed survival mechanisms that got you to today.
Yes.
Now, do you want to keep using those mechanisms, right, moving forward? I think I'm a big fan of not calling people victims, but survivors.
Yes. Yes.
Because victimhood is powerless. I can never be happy. I think one of the things we see in our society is many people have decided their pathway to happiness is victimhood.
Yes.
Twitter is full of it. But the problem is all of those people are miserable.
Yes.
Because they don't have any agency. If I can survive the trauma, and I kind of think trauma from day one, being born is traumatic.
It is.
I mean, you're happy, you're warm, you've got taken care of everything, and now you're in this cold, awful world where you're totally helpless. The only thing you know how to do to get your needs met is scream.
Yes.
And then you're vulnerable and helpless in a world of giants. Adler, of course, the Adlerian approach talks a lot about this. the sense of born innate inferiority. And I also kind of come at it from a wounding standpoint. It's like, no matter how good a parent you are, you're going to hurt your kids somehow. There's some wounding.
Yes.
We all grow up kind of hurt. Some parents do a lot more damage than others, but we all grow up with wounds. We all have things that we experience. And I love you've used the word grace several times. And I just, that's so critical for people to get through their trauma, because the people they really have got to have grace for is themselves.
Yes, absolutely. That's where I start with them.
Yeah. And of course, if we could put that into a pill, I'd be a rich man, right? You know, the world would be a much better place, because the person we struggle to forgive the most is us.
Yes.
And have some grace about that. So I kind of love this idea that part of what you're doing is, let me tell you some about my journey to give myself grace.
Yes.
And of course, you know, as my therapist says, I can tell you some glib stuff. Now, is it easy? No. Do I do it well? No. I'm kind of the same way with my clients. Okay, this sounds good. And if you get it figured out how to do it, let me know.
Right.
We got to work
and
at it
understanding
together.
that at times we set our own selves up for failure.
Mm-hmm.
You know, it's talking about like, okay, at the beginning of the year, everyone's like following these fad diets about, okay, I'm going to lose 30 pounds by next month. Okay, come on, let's be realistic.
Right.
You know, so you're already defeated by projecting this idea of, yes, I'm going to lose 30 pounds in 30 days. Really? Like, how can that really happen? And how can you sustain that? So something that I, excuse me, I also incorporate is baby goals. Mm-hmm. For today. What do you want to focus on for today?
I like that.
Is it like, what are your goals with regards to like exercising, eating habits, sleeping habits? Let's start there, because healing, you know, starts from within. Are you drinking enough water? Well, I cannot drink a gallon of water in a day. Okay, I understand that. Can we start with maybe 16 ounces? Can we, or maybe if you do a little bit more, you know, give yourself that, be your own cheerleader, give yourself that own, you know, pep talk to say, hey, yes, I did it. And that will get you more motivated,
right,
to succeed versus I'm looking at losing 30 pounds in 30 days. Can I be happy or content with who I am now to make minor shifts in my life where I can improve my quality of life?
Right. That makes a lot of sense. So, yeah. And so you're engaging, I kind of, you know, you engage clients, you've got a kind of a bunch of tools in the toolbox.
Yes.
You've got the client, they're brand new, they're coming in. I think maybe I've got some trauma I need to deal with. You know, a lot of times they're kind of in that, I don't know, I've decided to reach out, I'm here. Maybe I want to talk about this. How do you open your engagement with those new clients?
Well, you know, first I talked about informed consent. I also talk about HIPAA. I talk about my ability to just be there for them. Mm-hmm. You know, it's more so like, I'm here to help you. And I always use the analogy of, this is your life. Let's look at this as you're the driver and right. I'm in the passenger seat. And I'm pretty much your guide, you know, in one sense or another. But when it comes to trauma, a lot of psychoeducation. I talk a lot about attachment. What does that look like? You know, who was there for you? Who's your safety net? Who is your support in a time of need, or who's celebrating your accomplishments?
Right.
And also inquire, okay, so what are things that you want to change? What are things that you want to improve for yourself, whether it's in a professional level, in a personal level? And also explaining to them that healing takes time. And reminding them that this is at their own pace. This is a marathon. You know, we're not sprinting, you know, it's not that easy fix. I wish it was. And also inquiring, what are you doing now
Right.
to help cope? Is it working? If
And
not,
yeah,
well, maybe let's,
so often it's not working as well as maybe it used to. Right.
right.
This worked when I was 12. I'm 37. Maybe I need
Yeah.
to do something different. And one of the things I like, you said, well, what do you want to change? I know one of the things I was like, well, and why do you want to change that?
Yes.
Yeah. So often I find clients, especially with trauma, are trying to make themselves, you said earlier, like this ideal.
Mm-hmm.
And that ideal may not even be close to whatever their actual self that they really want to be, right? It's like, well, this is
Yes.
because what other people have told me, or this is what I think I need to be in order to be successful. I see this a lot in men who, because part of it's our society kind of gives us what I call the Zeus archetype.
Yes.
You need to be a powerful CEO, lightning bolts, large and in charge. That doesn't leave a lot of room for men maybe that have a more feminine trait too, maybe, or more sensitive or creative or energetic. And Zeus cheated on his wife a lot. I don't know how, but you look in our society, have all these powerful men that cheat on their wives.
Yes.
Yeah. And
it all comes from identity.
Yeah. I've got to, this is who I got to. So I find a lot of times it's like, what are you trying to do to change? And let's talk about, right, why do you want to do that? Well, I don't feel, I was always told I was no good, and this is how I've got to feel good. Okay. Yeah. So it's amazing. It's also amazing to me with trauma, what can be experienced traumatically by one person that nobody else thought was traumatic for them at the time.
Yes.
Other people will say to them, so I love your validation approach. We're going to talk about it. It was traumatic to you. That's enough.
Yes. And to piggyback on that, and, something that I learned, with reading that book from Dr. Nicole LaPera, is normalizing therapy and normalizing trauma.
Mm-hmm.
You hit, a great point because, for instance, you may have, and, with me working with various clients in different walks of life, you may have somebody who was sexually assaulted, right?
Mm-hmm.
Or you may have someone whose dog died. And both events are traumatic. So it's normalizing to say neither situation is worse than the other, because it's how the person perceives it, and understanding that trauma is trauma. And it doesn't necessarily need to be an event.
Yes. Yeah.
Right.
It can be lack of an event. And
yes.
And there's no characterological, oh, you're weak because you're traumatized because your dog died. Right.
Right.
It's no, this is where you were when it happened. I'm a big believer with the statement, information is therapy.
Yes.
Yes. I'm going to normalize things. I'm going to help you give yourself some grace because I'm going to give you some grace. One of the wonderful things about therapy is it's an area where somebody can say, okay, you've done this. All right. You cheated on your spouse. There will be consequences for that.
Yes.
But I'm not going to be the person beating you over the head about it. Right. There's going to be enough people in your life condemning you. I'm going to help you figure out what your next steps are. Right.
Yes.
Yeah. So I think that's a great, I think you're exactly on point. We're going to create this space for you. Said, I like passenger seat. I've said to people, I'm your Sherpa, but I'm not going to carry any of your baggage for you. I'll be your guide, but I'm not carrying, I can't carry any of your stuff. I've got my own stuff. So it's a great environment where people can actually kind of say, well, let me really get in touch with what I'm saying and feeling and what is normal and what's okay and what's not okay. And little thing, a client beating up on himself because he didn't, get his files done exactly the same way as his dad did. And I'm like, and right? Do you have to?
Right.
Do you have to?
What do you want to do?
Right.
What do you want?
Who are you?
Right.
Right. Who do you choose to be moving in the future? And it's hard. I mean, I'm sure I've done it to my children too. I know I have, because I've got some image of who I want them to be and how I want them to be. That is probably not how they're going to be.
Right.
And they have the right to decide that for themselves.
Mm-hmm.
And, you know, because you're telling, sometimes, I know, I'm sure you're there, sometimes I've told this to somebody in their 60s or 70s. It's like, now that you're 70, do you think it's time that you can live your own life?
Yes.
Yeah. I wish they had come to see, well, it wouldn't have been me, but they'd come to see somebody sooner to say, hey, you can live your own life. So, well, it's kind of, the world's been crazy for 2 years. I know teletherapy has just exploded. I'm still only seeing people 1 day a week, and I started back in April, or face-to-face, and I've never managed to need more than 1 day a week face-to-face because I'm doing a bunch of teletherapy. So I'm really kind of interested in how you're offering services, and now the world of 2022, especially with trauma and EMDR and some of these things. You know, what does your practice look like these days?
So I provide teletherapy.
Okay.
And this is the best thing that was ever created. Because honestly, you know, you do it at the convenience of your client's time.
Mm-hmm.
They don't have to drive anywhere. You know, now, you know, they also have other options of, you know, having the live video sessions, or even talk just, you know, by using a phone, or even texting, you know. So, I mean, being available to clients in that manner is very important, but I find that people are more engaged. With regards to EMDR, it depends. There are some therapists out there that do not believe that you'll get the best like process with, you know, virtual EMDR, but I really like it. You know, I'm working with you know, a client right now, which, you know, I'm using it with her, and I've seen great strides. I've seen, you know, great interactions and processes with her, and it's amazing. So, I mean, I think it's just how you know, are able to work with your client. But, you know, sometimes, you know, one thing that I sometimes gets in the way is the, you know, technical issues.
Yeah, that I have experienced that too. It's like, let's reboot, let's do this. So, yeah, it can get in the way.
Yes.
I agree with you. So I think I really do like face-to-face meetings with people. I enjoy the connection. I like being with them. And though I'm seeing more people who I don't think would see a therapist otherwise. So people, they may be in their car because they've come out to their car at lunchtime or taking a break. Okay.
Yes.
Right, I'm getting to see you. I'm, you know, okay, I'm seeing you first thing in the morning, you know, before you start your job. So yeah, I definitely feel that the teletherapy has been a boon for people getting some connection that otherwise they wouldn't have had opportunities that they would have had. And yeah, I've also heard people, I can't do EMDR over you know, teletherapy. So it's exciting to hear that you're having good results with it, and being able to get that using those things. And actually, now we've talked about EMDR a couple of times. Could you actually kind of tell the audience just very briefly what EMDR is as a therapy intervention?
Sure. So it's eye movement desensitization, reprocessing. And basically what ends up happening when someone experiences trauma, certain parts of our brain get deactivated. So the way, you know, that I like to explain it is, you know, it's as if we have a mohawk. So our frontal area is activated. We have our middle, which is more what the amygdala is, which is where our emotions are. And then the base of the head, where the vagus nerve starts. This vagus nerve is the ending of, you know, our brain, where a lot of our primitive reactions come from. So, you know, as a baby, we're crying, we need to be fed. You know, it sends those signals out. And it's also where you see our fight, flight, freeze reaction. Right. So when we experience a traumatic event, it alters our brain. So the size of our brain kind of like stopped working. So what EMDR does, it actually, by providing bilateral stimulation, meaning by tapping on either side, by tapping on your leg, by listening to certain sounds, you're able to reactivate those areas in your brain while processing those events that have caused you stress.
Because with the trauma, whenever we think about the trauma, our brain shuts down again.
Yes, everything, it shuts down, but also all those intense emotions get reactivated.
Right.
As if you would have experienced the event yesterday. So those, in the sense of flashbacks.
Right.
Some people have flashbacks, nightmares.
Right. Oh, I love that. So I love that. Okay, that's good. We're bringing more of the brain to bear. Oh, that's perfect. That's why I always tell clients about journaling.
Yes.
You're using more of your brain. You're not just kind of thinking about it, but you've got to see, you've got to write. You ask somebody a question, and when you hear yourself ask the question, how do I know the answer? Well, part of that is because you spoke.
Yes.
And literally helped get information. From this hemisphere to this hemisphere, because this ear heard it.
Yes.
They do a lot of that work with people with nonverbal learning disability because their corpus callosums are reduced.
Yes.
To speak stuff across. So I hadn't thought about it that way. It's really, that's pretty powerful. It's very important to try to be able to live through the experience again and process it in a less threatening way. And so often with trauma, what really happened is we got frozen, and it's kind of to the point, fight, flight, or freeze. That sensation's just kind of frozen in our brain.
And also explaining what fight, flight, and freeze. I have clients that have witnessed, trauma, and this sense of guilt. I should have done something, but I don't know why I didn't. So explaining, well, you froze. That's how your body reacted to the incident. And when you see that light bulb, come on, and you see that reaction, they're able to accept that there was nothing that they could have done to change the situation.
Right. Now I can have some grace for myself.
Yes.
Right. Because my nervous system decided the best thing to do is to stay perfectly still.
Yes. Yes.
So, it's kind of funny. I know in some of my training, one of our trainers, I did some of the work on somatic trauma work,
okay,
which I really love because I'm all about getting into the body. I'm an intellectual, rational guy. So how I know what I'm feeling sometimes is what's going on in my body. Oh, my leg hurts. I'm anxious. That's interesting.
Yes.
So he was talking about somatically. So we have that event, and later you have the shudders. And he's like, and we try to suppress that. He's like, don't let yourself have the shudders. Let you pull over to the side of the road and have the experience. That's the tension leaving your body. You hang on to it. Now you're carrying that around.
Yes.
However long till you blow up. In my case, if I get angry. So I think where we're so much of the trauma work, that what we're discovering is how interconnected, our brain may stop here.
Yes.
But we are not our brain. We're our entire body. We're our entire central nervous system. We're all these there's all the neurons we have around our stomachs, which, by the way, is where our brains used to be.
Right, but because of the vagus nerve.
Yeah, well, I mean, literally here was right here in our stomach is when we were embryos, and then we.
Okay. Yes, you're right. Yes. Yes. Yes.
And somehow these cells down here knew to be stomach cells, and these cells up here knew to be brain cells, but we're these interconnected beings. And so what I love about some of the polyvagal work and the somatic work and EMDR is, we're tapping. Let's tap. Let's get our whole bodies involved in managing our trauma, because our whole bodies were there when the trauma happened. So, well, I know you're getting you're doing your postmaster's studies. What other, do you have like kind of other professional goals that you're looking to do in the future?
To be honest, I want to do more work within the child protection realm. I am a certified doula for in labor, postpartum, and infant care. But going back to helping moms,
Okay.
Being able to provide more therapy to women postpartum, and also, there's that, also postpartum depression that changed. Now it's perinatal mood and anxiety disorder. So providing more psychoeducation on that, like what you're experiencing postpartum, some things are normal, and also encouraging more women to be more open about it. In addition to, men can get this as well, partners. Right. It's not just the mom. This is a significant event. We just had a baby. What do we do? So it's providing more psychoeducation and also teaching positive nurturing attachment, because this will form healthier parent-child relationships that will create healthier adults.
Right. Okay, well, clearly we had a little bit of camera glitch, but I think we've gotten it fixed. So yeah, I think that's all very important to, and it's interesting how much that parallels your work. Oh, well, we didn't focus enough on the families, we focused on kids. Now we're starting to focus more on moms. Well, wait a minute, what about male partners in these situations? And
yes.
So yeah, I think that's, to me, part of what's happened is there used to be some kind of social norms or supports, and families were better knit together, and oh, what's going on? And you had parents that were closer, and I think that a lot of that we've lost. We made some decisions about how we were going to be culturally, and we lost some of the hereditary wisdom, as it were. And something of living in a society that's very kind of individual based and technically based, technique based, as opposed to maybe a little bit more holistic approach to things.
Yes.
And I think therapy is kind of holistic in its nature. We're talking, bringing the whole body into the picture, bringing the whole person into the picture. It's not, oh, I'm going to use 3 evidence-based practices and you're going to be better in 6 sessions. That's just not how it works. Well, I imagine we've got folks in the audience who are interested in finding a therapist. Do you have any recommendations for them about how do I find a therapist that's going to be able to help me if I've got trauma I want to work on?
I usually encourage clients to look into Psychology Today.
Okay.
I really like that platform, just because they can do a specific search for clinicians, therapists, counselors in their area. So they use their zip code, and they are able to look at specifically, do they accept their insurance? Can they address trauma? There's other platforms as well, like Open Path. There's Alma. They're in the virtual realm as well. Some clients utilize Talkspace or even BetterHelp.
Right.
Those are out there as well. But I encourage clients to read, those biographies, and reach out to their clinicians. A lot of clinicians offer a free intro consultation where they can get to meet their clinician and say, oh, okay, is this a good match for me or not? And also understanding that if it's not a good match, it's okay. This is your healing journey.
Absolutely.
You need to have that connection. And if you don't waste your time.
Right. You can go see somebody else. I tell my clients, 1 session with me 20 sessions with me does not obligate you for another one.
Right.
Right. As one of my old therapists used to say, am I going to see you again? That's how we'd finish every session.
Yeah.
But yeah. I'm like, yeah, I saw him until he retired. So, well, one of the big things I want to get to, I know we're coming up on about 40 minutes already. So, these things always fascinate me, and we talk. But dealing with people's trauma, I know, can be very intense and emotional. So how do you handle your work-life balance? You talked about clients being able to text you. So what do you do to take care of you?
There's a balance. So, sometimes it's difficult. I'm going to be very honest. Sometimes I have to remind myself, hello, practice what you preach.
Right.
But I do have a relationship with God. So that's my strength.
Right.
I, spend time with my family, with my friends. I love reading. And also processing my day, journaling, seeking out mentors in the community. I'm part of a women's leadership group, and I love these women. They have helped me tremendously along my healing journey. Someone that I can call and say, hey, this happened, can you just lend an ear? And also therapy. Therapy is important, engaging in individual therapy, couples counseling, even with spiritual leaders.
Right. I agree. I've got to, if I'm going to be an effective therapist, I got to have some idea what my own baggage is.
Yes.
Because my stuff's going to be talking with the client stuff while I'm meeting with a client. I need to know what that conversation is. And so, yeah, I'm a big believer that therapists should be doing their own work.
Yes.
Because you never know as a therapist when somebody's going to say something that pushes one of your wounds, and you're like, ooh. But
right.
Now that's interesting. I'm having those feelings. I want to be able to pay attention to the feelings and wonder what's going on, and not have them be in the driver's seat. I want my feelings in the passenger seat.
Yes.
As much as possible. So, and I love the community engagement aspect too. I do think that's a big part of being healthy and supportive. I'm active in my professional organization, LPCF Georgia. So,
okay.
In fact, I'm president-elect this year. I have a convention to put on in May, I'm engaged in my church and scouts and things, and I get real meaning out of those things. So I guess my last question then is going to be, how has treatment impacted your clients? What do you see?
Transformation.
Okay.
Transformation. As I'm providing psychoeducation on trauma, you see some resistant clients like, oh, no, that's not trauma. That's not trauma. And, having to break it down and say, trauma doesn't have to be like you seeing a car wreck or seeing, I don't know, your dog get ran over or something like that.
Right.
It could be, explaining what healthy attachment looks like, understanding that you, whether male or female, if you are sitting alone at a young age, trying to manage your feelings, not being allowed to talk about your feelings, that creates a lot of insecurities, that creates a lot of, internalization of many things. And it creates, unhealthy patterns in relationships when you get to become an adult.
Well, and you might be allowed to talk about your feelings, but you choose not to.
Yes.
Like, this thing I'm not going to talk about.
Yes.
This upset me, but I'm not going to talk about it. That my little trauma into second grade. It was a girl I really liked, and I kissed her on the cheek without asking for permission. Which I guess today, I'm putting this on the internet so I can be canceled. But she was really upset with me and wouldn't talk to me. And I tried to spend the rest of the last day of school trying to apologize, and she didn't want to talk to me. And so I spent all summer figuring out how I was going to apologize. She didn't come back to school the next year.
Wow.
I didn't tell anybody. I didn't tell my parents, who were very loving and supportive. I didn't tell anybody. The response I had to that was my willingness to initiate any contact with a woman, any physical touch at all, was zero. The girl I went to my freshman prom with, she was the one that had to initiate the hug and the kiss. I'm like, oh, that's kind of nice. When I started dating my wife in college, I remember we were just gotten together, and And I certainly was in love at this point, or in love, as I like to call it. But she said, "What are you thinking?" I said, "I'm trying to work up the courage to kiss you." Which got what I wanted, which was a kiss, right? I was cute and adorable, and I got my kiss out of it. But I couldn't bring myself to kiss this person.
Yes.
Yeah. So.
Yes. Mm-hmm.
So,
but yeah,
that was
it's amazing.
Little T trauma with a significant impact on how Bryan interacted with women. And my comfort level today is we do, because, hey, we're doing the photo, we're doing the picture. It took me a long time just to be comfortable to put my arm around somebody. They're putting their arm around me. It's like, okay, I guess that's all right for the photo.
Mm-hmm.
They're being casual.
So yeah, so, things like that.
Yeah, and people won't say it's a trauma, and it's so powerful to be. And of course, I didn't even bring it up with therapists because I didn't even think it was a trauma. But until I was much older, it's like, oh, that was a big deal.
Mm-hmm.
Oh, how I feel now is all that shame and guilt. So yeah, I love transformation's fantastic to be able to see, and that's why we do it.
So amazing. Yes, really. And like I said, like having that compassion when and with working with clients and having them understand, like, this is really your safe space. Like, I see people struggling with cursing and this, that, and the third. I'm like, listen, I'm not gonna curse, but you're paying for this.
Right. Curse all you want. It uses it, well, let me throw this out there. Cursing uses a different part of our brain.
Okay.
That's why Tourette's happens with cursing. It uses the alarm circuitry in the brain. It's like the monkeys or the meerkats saying, "Hey, hawk, predator," uses that circuitry. So cursing, stutterers curse. When they curse, they don't stutter. Different part of the brain. So we're about bringing the whole brain together. And sometimes I'm like that with a client. I'm like, I'll curse for them. I'll be like, "So what? I hear you," because I can just tell they want to do it, right? It's like,
yes.
What you're saying is, and they're like, "Yes,"
right.
And that they're able to connect to it. Well,
yes.
But every time I do one of these, I feel like I could just talk for 3 hours. I was just always so.
It's okay.
Fascinating. We'll make sure that your contact information is down below. In the comments. And this has just been really great. I appreciate you being here.
Thank you for the opportunity, because I'm literally new to Georgia. I'm still trying to brand myself and get myself out there. I'm trying to engage in more community events. Like I actually, there are not a lot of Spanish speaking clinicians here in Georgia.
Right.
So there's this small organization called Sanando, which means healing. So they have a few community events that I've attended. But I'm, trying to get out there more. Like, hey, offering, because I am bilingual. So offering more of that as well. Yeah.
Well,
bicultural.
Any of those things you want me to put in the comments or in the description, shoot to me.
Absolutely.
I'll make sure that they're down there. And of course, for our viewers, it's YouTube. So it would help if you like, share, and subscribe to talk.
What is the name of, I'm not on YouTube, but what is the name of your?
So these will all appear on the website in my blog, TalkForwardCounseling.com. But there's also the TalkForward YouTube site. But these show up as like an embedded video.
Okay.
And feel free to link to it.
I will, because I'm always on YouTube, either listening to a sermon or listening to praise and worship, something to get me motivated and activated throughout the day.
Yeah, well, it sounds good. Thank you so much. I've enjoyed this.
Thank you very much.